Andreas, can you tell us what are the signs and symptoms that someone may have familial chylomicronemia syndrome?
So these patients usually come to us, they're usually admitted to the hospital actually with severe abdominal pain that frequently represents an episode of pancreatitis, that it's triggered by the high levels of triacylglycerides. Patients with this condition also, particularly when the triacylglycerides get so high and the blood gets so viscous, patients may have what they call this brain fogginess. They have some memory loss. They may be a little bit confused. One of the things that I find actually quite interesting is that when you start to treat them, you start to see that everything starts to go back to normal, and that significant others usually know when attack it's about to happen because they start to act a little bit different. For some reason that we don't really understand, and there's some hypotheses, but patients with this condition frequently have just chronic abdominal pain that it's not pancreatitis. The reason why we see them in the hospital is because they have severe pain that represents frequently pancreatitis. So pain doesn't equal pancreatitis. When we have these patients in the office and we're doing physical examinations, we tend to see xanthomas, which is basically the medical terminology for accumulation of fat within the skin. And you can see that any place in the body, but the typical spots are around the eyes, or you can see it also in the gluteal area, you can see it in the thighs, you can see it more or less anywhere in the body. When these patients get an eye examination also, you can see some spots in the eyes also that represents hypertriacylglyceridemia that actually of interest, they completely go away once the levels start to trend down. Going more into the physical exam, your doctor very likely is going to be present on your abdomen, and they can feel that the liver may be a little bit enlarged, the spleen may be a little bit enlarged, and this is because of so much fat accumulation in the liver that it's triggering what is called hepato and splenomegaly.
And blood tests, besides my triglycerides generally being well over 1,000 if I have FCS, any other abnormalities that might be a clue we should be thinking about this?
Platelet counts also can go down or they can be low. And patients with this condition also have a higher incidence of hemolysis. So all of these taken together should be clues that the patient may have this rare condition.